I'm Joe Halco, Director of Community Relations for Northwestern Counseling and Support Services, and welcome to another episode of NCSS Here for You. Since 1958, Northwestern Counseling and Support Services has been providing access to high-quality services which promote healthy living and emotional well-being to the residents of Franklin and Grand Isle counties. Over the years, as the needs of the community have changed, so too have the programs and services that we make available to assist children, adolescents, adults, families, and seniors. We take our role in the community seriously and strive to provide a continuum of the highest quality services to meet the needs of individuals who at any point seek assistance. October is Down Syndrome Awareness Month, and this month's episode is titled Understanding Down Syndrome. Down syndrome is the most commonly occurring chromosomal condition, and it occurs in approximately 1 out of every 691 births in people of all races and economic levels. The addition of a third copy of the 21st chromosome alters the course of development, resulting in all people with Down syndrome experiencing cognitive delays. Today, we'll learn more about Down syndrome, positive strategies for families, who are the children's most important resource, support services, and much more. To discuss the topic of Down syndrome in greater detail, I'm pleased to introduce this month's guests. They are Samantha Thomas, Director of the Developmental Services Division, Claire Thompson, Pathways Team Leader at the NCSS Academy of Learning, and Casey Carpenter, a member of the NCSS Developmental Services Crisis Team. And I'd like to welcome all of you to the program this month.
Thank you, Joe. Good morning.
So let's start with, would you describe Down syndrome and how it is caused? I know I talked a little bit in the opening, but certainly nowhere near the depth.
So Down syndrome is a genetic disorder caused when there is an extra chromosome present, which is chromosome 21. And this extra chromosome causes the developmental changes and physical features of Down syndrome. As you said, it's the most common genetic chromosomal disorder and cause of learning disabilities with children. And each year there are about 6,000 babies that are born in the United States with Down syndrome. There are also other risk factors that are involved, like a woman's age. Once a woman turns over 35, the risk goes up, the increase to have a child with Down syndrome. Although most babies with Down syndrome are born to women under 35 just because they are having far more babies than older women. And another risk factor is that if you have already had a child with Down syndrome, then you have a greater risk of having another child with Down syndrome.
And how is Down syndrome diagnosed?
So in utero, while a fetus is developing, there are screening tests and there are diagnostic tests. So there's a number of screening tests that physicians use these days. And screening tests can indicate the likelihood or the chances that a mother is carrying a baby with Down syndrome. On the other side, there are diagnostic tests like CVS, which is called chorionic villus sampling. The other test is called an amniocentesis. And both of those tests use chromosomal analysis to identify the presence or absence of Down syndrome. Newborns can also be tested for the presence or absence of Down syndrome if it wasn't identified prior to birth. Claire mentioned that there are some physical features that can be common. So if Down syndrome wasn't identified before birth, if there's evidence or presence of some of those physical characteristics, a physician might do a test called a chromosomal karyotype. And just like the CVS and the amniocentesis, that is taking a sample and looking at the chromosomes of the baby to look at that chromosome that Claire mentioned earlier.
Mm-hmm. And can you debunk some of the myths about Down syndrome?
Certainly. I think one of the most common myths that I hear about is that folks with Down syndrome are just always happy and always up and happy to see everybody, which of course, is often the case that folks with Down syndrome are lovely individuals, but I think the disservice that it does is that they also, just like everyone else, do experience the whole host of human emotions. So folks with Down syndrome don't have, any limitations on their emotional experiences in life. So just like the rest of us, they feel anger and frustration and hurt and happiness and friendship and joy. So I think that's a bit of a disservice to pigeonhole that emotional experience. And so being aware that that is the experience of everyone. So that's one of the biggest myths that I hear of regarding Down syndrome. Another is that the life expectancy for someone with Down syndrome is significantly shortened. And that did used to be the case. Science and treatment has come an extraordinarily long way in addressing that. So back in 1983, the expectation for life for a person with Down syndrome was about age 25. And today it's more like 60, which is remarkable. And we're seeing that in the individuals that we serve who have Down syndrome, that they are, happily and successfully living into their 50s and 60s, which is really wonderful to see that growth and that advancement in science. And I think also in the services that are being offered to families and individuals with Down syndrome, I think it speaks to that as well. I know Claire had spoken also to the idea that it's more likely that women over 35 you're more likely to have a child with Down syndrome, and she spoke a little bit about that. So it may seem like the numbers are higher, but it's just because folks under 35 are having more babies. So the ratio is higher, but you do have an increased chance over the age of 35 to have a child with Down syndrome. And then another myth that I hear about is that there's a limited opportunities for people with Down syndrome. And I think it's really been lovely that in the last few years, I've seen individuals with Down syndrome as actresses and actors, as models, as social media influencers. And I think that's one of the positive outcomes of social media, is it gives an opportunity for folks who may not otherwise have that to be a part of the greater world. And then the individuals that we've served with Down syndrome are productive members of their communities and have jobs and do volunteer work. So the limitations are getting smaller and smaller for individuals with Down syndromes as we're giving them the opportunities to be supported, to take advantage of all of those opportunities. So that's really wonderful. We're limiting the limits, which is exciting.
And getting married. People think that
Yes.
people with Down syndrome shouldn't get married. I mean, or can't get married. Well, of course they can get married, just like anybody else.
Yeah. Mm-hmm.
So a couple of stark things that you mentioned there that are really, really exciting, Casey, is number one, the life expectancy is more than doubled. That is
Yes.
huge.
Yeah.
And then, secondly, the fact that they're able to be contributors to society, which again, as I know is something that many people at first glance wouldn't think that these individuals would be able to, to do. And I know and we'll talk about some of our programming later, but I do know that with our employment services team and what have you, I mean, we're really trying to have individuals be as independent as they can and get the most out of life.
Yeah.
Exactly.
I was going to mention later on, but I do have two brothers with Down syndrome, and one of my brothers worked here at a local restaurant for 13 years and loved his job and was very successful at his job. So I don't think there needs to be any limitations set forth for anybody with a disability.
Yeah, that's terrific, Claire. So NCSS has hosted an annual fundraiser called the Buddy Walk, and can you tell me a little bit about that?
Sure. So the Buddy Walk was developed by the National Down Syndrome Society in 1995 to celebrate Down Syndrome Awareness Month, which is October, as you said, Joe, and to promote acceptance and inclusion of people with Down syndrome. Since 1995, the Buddy Walk has become the premier advocacy event for people with Down syndrome in the United States. So it's nationwide. The Buddy Walk raises money for the National Down Syndrome Society, and the funds make a difference locally, as 93% of the net proceeds raised from this event benefit Franklin and Grand Isle County residents with Down syndrome through NCSS programs and services, and the remaining 7% is utilized by the National Down Syndrome Society to advocate on advocacy and public awareness initiatives. And NCSS has participated in the Buddy Walk for 11 years now and has raised over $40,000 by participating and hosting this annual event, which normally takes place in the fall, but unfortunately, with COVID, we won't be doing it this year, but hopefully next year we'll get it back up and running again. Well, not hopefully, we will. and keep going and raising money for an excellent cause.
Yeah, it is a great cause. And, one of the nice things about a walk like that is when you bring together individuals who all have the same diagnosis, but of course, everyone is unique. But you bring them together for an afternoon for, a walk. And then there's also other things that they're able to do as far as activities are concerned. And there's food and that type of thing. But what is really gratifying is to see the looks on the faces of all the individuals who are participating and walking and, having their faces painted, face painting, or whatever the case may be.
It's really a fun event.
Yeah, it really, and certainly you can see that they truly do look forward to that each and every year. And as you said, Claire, it's just a 1-year hiatus. And then next year, NCSS will be back at organizing yet another Buddy Walk. So,
I look forward to it. I think it's a spectacular event.
Yeah, just wanted to mention, you can just see what it means to all these individuals, and it's great to see the smiles on their faces and the excitement when they're there.
And it's
Oh, sorry, Joe. I think you capture that really well every year at the beginning of the walk when we're all grouped together getting ready to go around the track, and you take that picture. In that picture, you can see everybody's excitement and their energy, and it's very exciting to participate. And I hope that next year we double our numbers and we get even more folks involved.
I would agree entirely, Sam.
And, I think it's, and as Claire pointed out, there are walks all around the world, Buddy Walks all around the world. And even though there are so many all around the world, the reality is it always gets down to it's a very local event and it has a local feel to it. And, from a Franklin Grand Isle County perspective, our walk, having it early in the fall as the leaves are turning and all the other things that are going on, I just think it's a perfect way to, to celebrate each and every one of the individuals that are there.
Yeah, and our community really comes together. People, businesses that make donations and, help us to put on the event is just we're always very grateful to our community partners for that.
No, absolutely. So, what are some of the strategies that families can use to enhance the lives of the individuals with Down syndrome?
Well, I think that some of the strategies that families can use to enhance the lives of individuals with Down syndrome are the same strategies that you would use to enhance anyone's life. Just because someone has Down syndrome doesn't mean that their expectations to lead a full, meaningful life should be any different than anybody else's. Like I said, I have 2 brothers with Down syndrome, and our family would have been incomplete without them. Having brothers with Down syndrome, I have seen the changes in accepting people with Down syndrome into society. When my brother Jamie was born, which was over 50 years ago now, my mother was told to put him in an institute. And, it was 50 years ago and things were very different then, and she refused. And, she had to fight to get him into the public schools. Things were just so different then. And I'm so happy to say that things have changed, obviously. you know, it's great to see all the changes that have occurred over the years, but I still feel there is still stigma out there that needs to be overcome in order to accept people with disabilities into our everyday lives. And so that's why we continue to have these shows to, you know, provide people with information so that we can overcome the stigma that still is out there at times. So, but it's been so great to see. I've been an advocate for my brothers, both of them, and it's just so great to see the changes. And I just want to see them continue, and I know that they will. So.
Oh, that is great, Claire. And what can the community do to create a safe and accepting environment for individuals with Down syndrome?
Watch this show, right? More knowledgeable, learn more, increase your understanding. You know, each community member get a better understanding of what is Down syndrome, get a better understanding of what we've been talking about today, the myths that Casey debunked. You know, there's a word that we use in the developmental services world, and it's one of our strongest principles, and it's a term called self-determination. And we strive every day to make sure that the folks that we serve, individuals with Down syndrome and other developmental disabilities, understand and know that they have the right to make choices for themselves, that they can decide what their goals are, that they can achieve their goals. And we work hard on that to make sure that folks understand that the folks that we're serving, their family members, the people in their lives, and also, you know, via this show and in other ways, making sure that our community members understand that as well. Because we know in our society that when we understand things, we are more welcoming and we are more accepting. And so ultimately, you know, we would ask our community to welcome the individuals that are our community members with Down syndrome into the community and into community activities, just as you would anyone else with any other needs or abilities in our community. We all deserve to have access, and I think it's important to continue to increase our understanding so that folks can continue to make those welcoming gestures to folks.
Mm-hmm. Well, that is terrific. And let's talk a little bit about a lot of the services that NCSS provides to individuals. You know, everything from service coordination, housing, et cetera, and you know, give people a greater understanding of the depth of and the breadth of all of the various services that we provide.
Yeah, certainly. I think what we talk about a lot in our agency is having wraparound services for folks. So being really aware of whatever the needs may be, and they may be slightly different for different folks, but we do offer service coordination or case management. And that's one of the roles that I provide at the agency, where, as Sam was saying, we really focus on assessing what is it that the individual really wants. What is it the family or individual or support team wants for the person receiving services, and then working really hard to make that happen to the best of our ability. So it's that person-centered design of planning. What is it we can do to help you achieve all of your goals and dreams? So service coordination has a lot of kind of fingers in the pot. So we might help with coordinating medical care, transporting to medical appointments, learning about new opportunities for medical care or treatment or interventions. We also provide housing for individuals. So a lot of folks do have families that they live with, or they live with family members up until a certain point when that's just not feasible any longer. So at NCSS, we do have a team that will help provide housing for folks who need that. And kind of a brief overlook of what that looks like is we contract with people who will welcome individuals into their home. And that home provider, as we call it, is expected to provide a stable and safe environment for the individual. So they would kind of, with the whole support team, be aware of medications are being taken properly and in the right method. People are getting to their medical appointments. They're getting access to the community. They are welcomed as a member of the family. So they're included in community events, family events, social events, and kind of provide that stable environment for the individual. So housing is, if needed, is a big part of what we provide at NCSS. Speaking a little bit more about that community inclusion and welcoming that we've all been discussing, is we do find and train staff to work with individuals. So, you know, whereas I might go out and make friends and join a club or do something like that, if I'm feeling I want to become a part of my community, someone else may want to do that, but just needs a little support in how to make those initial connections or guidance in how to access those things. So our staffing provides individuals with that. And we have a lot of really great staff who have gone above and beyond to even create places for individuals with Down syndrome or with other needs to be welcomed into the community. And that's always so fantastic to see. So that community inclusion is a big part of what we provide as well. I mentioned the medical oversight. So between if it's a home provider or a case manager or guardian, that's very important. As a state-funded organization, we do have regulations, and it is in the client's best interest to make sure that all of their medical needs are being met. So we do have oversight with that. And then finally, as you mentioned in the intro, I am on our DS crisis team. So we are unique in that our agency has a crisis support team that is solely devoted to developmental services. So our home providers, parents, individuals, staff have access to support 24 hours a day, 7 days a week, 365. So we have our crisis number that they can call if they need just someone to talk to, or if they need intervention, or if they need resources, that's available to people at all times. And it's unique and really exciting to have that, because individuals in the developmental services area, their needs may be slightly different. And so having that knowledge of that background is really helpful in a crisis situation to provide helpful supports.
And Casey, since that is something that is very unique to our organization as far as having the crisis line number, what number would people call in the event that they need assistance?
Certainly, that number is 802-393-6688. And what you do is it's a call center. So you leave your name and number, and then a crisis worker is paged and they call back. So it's a good question, because sometimes the process is a little bit, what are we doing here? I thought I was getting a crisis worker. So it's they will call, and usually within a few minutes you'll get a call back.
Okay, that's good for them to know.
Yeah. I can't say enough great things about our crisis team. They are just a great team, responsive, and you do get a call back within minutes. I think it's it's just they're very, very, it's a great team.
Thanks, Claire. Pretty proud to be part of it. Yeah.
Yeah, and you should be. That's
and,
great.
In overarching from that standpoint, with a lot of what Casey had to say, is you really begin to see and she used the term, I think, right out of the gate, which is the wraparound services that are offered. So it isn't as if somebody contacts us and we only do a little part of the piece. It's something that they can count on this organization to help them, every step of the way. I think that's important for people to understand as well.
I think so too. And I think, as, the new director, I've been on the job for about 2 months. Actually, I think my anniversary is today.
Happy anniversary, Sam.
Yes, happy anniversary.
And what I've noticed about this division is how creative we have been over the years in designing and developing supports that meet folks' needs, that allow them to achieve their hopes and dreams. Creative ways that we've designed programming that allow folks and encourage folks to be involved with our community. I think something important to note too is that, we have a very strong mental health component too. We have clinical therapists in our division that provide therapy for those folks that need it. And so I've just come to learn what a well-rounded package of supports and services we have to offer for folks with Down syndrome and other developmental needs.
And just to put in a plug, because another thing that our agency offers that I super enjoy and I'm just talking about and proud of all the time is our PAEA department, which is our arts and music area where all of our individuals have the opportunity to participate in musical concerts and bell choir and do arts and crafts, which are then shared with the entire community. Typically we have a billboard in Swanton that the clients are able to go and paint and decorate, and they do a theme and the whole community sees it. And then we have, again, in normal years, twice a year we have concerts that people can participate in, and we have drum players and choruses and guitar players and piano players, and the talent that you see is so wonderful, and everybody has such a good time. And again, it's that another really creative way to connect with the community. And I know I've brought community members and they're just blown away by what they see, and it's super fun.
Mm-hmm.
I'm glad you brought that up, Casey, because those are really great events that take place and just enjoyed by everyone.
Mm-hmm.
They are, and that program goes back, that is one of the more innovative programs for developmental services that was developed years ago here, in the state of Vermont, program for adaptive and expressive arts that, as you said,
I couldn't think of
it
that.
really ranges, from music to art and everything in between, and people are able to, express themselves the way that they want to, and it makes them feel good. And it's amazing. You're right. Some of the musicians and the talent and the artwork.
And the artwork's amazing artwork.
Amazing.
Yeah, absolutely. Yeah, just extremely. Again, it only goes to show that there really are no limitations if you give the individual the opportunity to be engaged, have access, and express themselves.
That's right. And I just have to say too, like Sam pointed out, the creativity that we have in DS and the thinking out of the box, and just in order to meet individual needs, whatever they may be, is something that I think we should all be very proud of.
Well, believe it or not, our time is up. I know it goes fast. So I do want to thank my guests, Samantha Thomas, Claire Thompson, and Casey Carpenter, for being on the show today and sharing their insights on the topic of Down syndrome. I also want to thank you, the viewer, for spending time with us again this month. You can learn more about all of our NCSS programs and services by logging on to ncssinc.org. I'm Joe Halco, and I'll be back next month with another episode of NCSS Here for You.